Hello everyone, this video will demonstrate fibrin glue hemostasis for persistent disc bleed. A 26-year-old gentleman diagnosed with occlusive vasculitis presented to our clinic. At presentation, visual acuity in the right eye was 20/25 and it was status post-laser with a florid neovascularization at the disc and pre-retinal hemorrhage. Left eye was 22/50 and he was post-vitreoretinal surgery with oil in situ. The left eye had few residual membranes with ischemic retina and no further intervention was planned. For the right eye, add laser was advised. The patient presented to us 2 months post-laser with a history of recent drop in vision. There was significant vitreous and subhyaloid hemorrhage. Early surgical intervention was advised as the patient was dependent on his right eye. Standard 25-gauge pars plana vitrectomy was done. Truncation was done and the vitreous and subhyaloid heme was cleared with the cutter. A membrane was noted overlying the disc, which was dissected and removed with the cutter. Following this maneuver, bleed from the disc was noted. The infusion pressure was immediately raised to 60 millimeters of mercury. But the bleed persisted in spite of the high infusion pressure and attempts at removal. A fluid-air exchange was done, but the bleed persisted. A decision was made to attempt fibrin glue application for the purpose of hemostasis. The injection system utilized comprises of a 1 cc tuberculin syringe for the injection of the thick component and a microdose injector connected to the viscous fluid injection mode on the vitrectomy machine for the injection of the thin component in a controlled manner. Using this technique, 1 drop each of the thick and thin component was sequentially applied. The fibrin glue coagulum, which then formed, was deposited over the disc using a flute needle. After securing the glue coagulum over the disc, an air fluid exchange was done and the case was closed under normal saline. On post-operative day 1, the patient's visual acuity had improved to 20/40. The retina was attached with no evidence of residual vitreous hemorrhage and the fibrin glue residue was visualized over the disc. At 1 week, the vision was 20/20 and the glue residue had completely resolved. At 1 month, the patient continued to do well with a visual acuity of 20/20. We believe that fibrin glue can be a valuable tool for hemostasis in the presence of persistent disc bleed. Glue is spontaneously absorbed in 1 week. Fibrin glue hemostasis allows for an early visual recovery and reduces the risk of persistent post-op vitreous hemorrhage.